All right, guys, we're kind of winding down to the end, so I appreciate everybody being here today, and also, again, Sinclair for having us here to really kind of help and guide you guys and give you guys pearls to take with you. As my presentation says, everything, everywhere, all at once, I did have the word spa dentistry, but we do cater, they do cater to everybody, right? So it's not just dentists that are here also. There's estheticians and RNs and PAs and MDs if they're here. You know, Sinclair does cater to everybody and helps everyone all the same. So again, my name is Josh Vang. Before I start, please feel free to come up to me, ask me if you guys need any help. More than happy to do anything I can to help you guys along the way. That's what we're here for. That's why we're doing what we do. So so we'll start here. So again, special thanks to Sinclair for, again, having us here. And before then, it was Viora. So I want to say thank you as always. A little bit about me, just real quick. I know I talked a little bit about my injectable career, but I graduated in '06, been practicing for about 18 years. I did teach pros for about 5. We did start to get into the med spa realm roughly around 2019, which was about 5 years ago. And it was just, I think, starting to really get exciting for a lot of people who were just starting it. And then that's where I did my Botox and filler training with DentaSpa seminars. I don't know if you guys know DentaSpa seminars. They are with Ana Delgado, who did her presentation earlier today. She spearheads the DentaSpa seminars, who caters to dentists. So if any of you guys are looking to jump into Botox or fillers, that is a great course. I know the AAFE also does a lot of Botox courses as well. So anywhere you go, honestly, you're going to get great training. You know, it's just whenever you're ready to jump on that saddle and really kind of take off from there. In 2008, bought my office. It was family owned. Transitioned to pretty much a dentist spa back in 2020. We had that pandemic thing called COVID that kind of shut everything down. So, but this is my office when we first started, kind of old school. 7-Eleven, if you guys know the colors, green, orange, you know, old colors there. This was our family sign when we took over. So this is why I bring this part up here. This is when we repainted the building and then rebranded into Cherokee Dental and Med Spa Clinic. So this is where I get into the whole, and they've touched base on it with rebranding. So if there's ever a time in your career where you want to change the name of your office and you want to do something different, jump into something that goes beyond what you're looking to do, this is a great opportunity for you to do it. And I'll give you a quick backstory on the word Cherokee. It's the name of the entire area, right? So every time someone came up to me, they always asked me if I am of Native American descent or if I work for, Indian Health Services, but it's the name of the location. So I always wanted to rebrand it if I could, just because it gave me that stigmatism there. But now this is where Sinclair has allowed me to really spread my wings. So we actually rebranded our office to Beyond Smiles DentaSpa. So we're doing full 360 treatments, from smiles to full body contouring to everything. So, and now we are actually moving from a 2,400 square foot building into a 6,000 square foot building where we'll have upper level for dental, lower level for med spa. So it's definitely given me that our office that opportunity to really broaden our horizons. Kind of going a little bit further, this is where I kind of get into the dental part, right? And I was talking about who are we. First thing, we're radiologists. We look at radiographs every day. We diagnose and we treat. Second thing, we're surgeons, right? We look at teeth. We look at the decay. We cut hard tissue, soft tissue. We're surgeons, pediatric dentists. We see children. Anyone who sees children, you're a pediatric dentist. This is where everyone laughs, because nerve tissue in teeth, you're technically a neurosurgeon. So if you're doing endo, you're doing nerve surgery. Veterinarian, most people don't go this route, but periodontists do go to the vet clinics and help out and really scale root planning some pets' mouths if they have calc and things like that. The last thing that we've all talked about and heard about is injectables. Every single day, you guys are injecting. You guys are doing anesthetic. You guys are the most skilled deliverers of anesthetic, of needles. There's no reason why you guys wouldn't want to be getting into Botox or fillers or biofillers, okay? So that's where you guys will set yourselves apart from the entire class of health professions out there. Last thing, you guys are cosmetic dentists. You guys are taking care of smile designs. You're taking care of whitening for patients who want to get a brighter smile. There's no reason for you guys to jump in, outside of jumping into this, not to jump into the world of cosmetics, full body. In the cosmetic world in dentistry, what are we looking at? We're always oral cavity focused, right? We're looking at facial aesthetics, symmetry, as Dr. Linga talked about, the golden ratio. We're looking at every single thing: lips, smile line, volume, length, shot size, contour, shape. That's what patients come to you as a dentist to help out. That's our job, is to help them with that. Let's take it a step further. We're gonna go into the cosmetic world. Why not take that, again, a step further and go look at the full body? You're just expanding your horizons. You're looking at everything that you're doing and taking a step further. Learning about skin. There's a lot to learn about skin. You're learning about adipose tissue. Everything that works within the body, you guys already know. You are doctors, right? It all comes 360 tenfold, right? Because we're looking at the smile. We're looking at the face. We're looking at the body. Everything comes together and connects properly for you guys as dentists to really get into this business. This is my personal quote. You know, it says, "Teeth are our internal support structures for our facial features, just as collagen is our support structure for our skin." It is the truth, because every time, and someone had mentioned it, by the time you hit 20, you lose 1% of collagen every year. So why not do our best to help our patients that come through our door and rebuild that collagen with a lot of the Sinclair devices that you guys have seen? That's really what it does. And everything is really moving towards an organic treatment. And so a lot of people are moving away from injectables and things like that. So I like this photo just because, you know, the cosmetic world, it is ever evolving. You know, you think about dermal fillers and you think about Botox when it first came in 20 years ago. It was injectables. Now everything is changing. Everything is they're looking for something that's more natural. They're looking for something that is going to give them 10, 15 years, if they're, you know, a look that's going to give them a refreshed look. It's really our job to see that evolution and really help the clients that come through our door. The moment they come through your door and you're able to help them do that, they will be a patient with you guys for life. Oh yes, it does. This is Google. If you read it, the beauty industry generates north of $500 billion in revenue worldwide. This is all together. I know we touched base on certain aspects of it. This is, in total, the beauty industry. Skincare alone, whether it's products, skin treatment, whatever you're doing, it is expected to generate in 2024 north of $180 billion. So if you think about it, $100 billion, this is one of my favorite slides here. Let's put it on the shelf. 11 zeros after that number 1. If any of you guys take 1% of $100 billion, you're looking at a billion, right? Let's go down further. 0.1% of 100 billion, you're at 100 million. Let's go further. 1/100th%, you're at $10 million. Let's go further. 1/1000th. Cool million, right? Last one, 1/10,000th. $100,000 of $100 billion. The beauty market is over $500 billion. So if you think about it, what you would invest, and you're ahead of that forefront of the other doctors and folks who are health professionals who are getting into this industry, that's $100,000 you can just put in your pocket, right? And the nice thing is this, it's cash-based. So, you know, you're not chasing insurance. You're not chasing co-pays. You're not running around in circles. You know, what I've done at my office is I've taken all of the revenue that I've taken and I've received from our aesthetics part, and I put it back into our office. I put it back into units. I put it back into my team, because that is what really builds your practice. However you want to do it, you take it fast or slow. But for me, I reinvest it in my team, and I reinvest it in the products that I know are going to give me the results that I want to send my clients. You guys are dentists. You are doctors. Understand that. You just specialize in the mouth and the oral cavity. But, as I say, no one ever will know the head and neck better than anyone besides a plastic surgeon. You guys are right on that top echelon of practitioners. I like this part too. This is my quote as well. If you take a look at the world of cosmetics, everything is overlapping. Nurses, estheticians, MDs, DOs, DDSs, you know, dentists to me, in the next 5 years, I guarantee you, will be the single most versatile health professional in the world. The reason why? Because nobody can come into your office or someone else's office that they can fix your smile, they can fix your lip lines, and then do the full body treatment for you. No one can do that. A plastic surgeon can't fix your teeth. They can't give you the smile line that you're deserving, that you're looking for. You guys set yourself apart from every health profession out there. There are tons of med spas out there. Why not you as a dentist get into it? This next part is, you know, I kind of went through my journey here and to really give you guys some pearls on how to start and why you should start. This is one of my most important slides. The reason a dentist should get into it is because, one, you see patients twice a year, and sometimes 3 or 4. If they have a huge treatment plan, you might see them 10 times. They trust you. There's a reason why they come to you. The mouth is so personable. They come to you because they trust you and they want someone that will treat them well and do a good job. In the mouth, it is so instrumental to have that relationship for that patient, for them to come to see you. You have patients, you have traffic flow. You don't have to advertise. Our office, we threw pamphlets out in the lobby. We weren't rushing to jump into it. Patients picked up a pamphlet, talked to our team, and it just started interest. So easy way to start. So if you're not ready to like go gung-ho, take your time. You can start fast, you can start slow. The other thing is, you as a dentist, you guys already have cash flow coming in. So it's like us investing in anything that we purchase, whether it's a laser, whether it's a Cavitron or a dental chair. You have revenue coming through. There's no need for you, to me, there was no need for you guys to worry about that because in time, you will pay it off. The biggest thing that sets you apart is if someone that opens up across the street and opens a med spa from scratch. They've invested in $200,000, $300,000 worth of equipment. They don't have any clients yet. You guys have 2,000, 3,000, 4,000. I know a doctor who's in Puerto Rico. He's got 20,000 patients. It's so simple for him to just advertise and throw pamphlets out there. I guarantee you 1 out of 100 will probably be very interested in there. So you've got the revenue for it. The next thing is, what are you guys looking to do when you get into this? Everyone is always worried about training, products, something that has reputable results, customer service, your price, bang for your buck, right? So the biggest thing is, that's why we're here. This is why you guys are here, to really learn and really understand why we're doing what we're doing. So I started out this journey here with Botox and fillers. You know, I did DentaSpa seminars. Again, we talked about that, touch base. I did all their courses, really went into TMD treatments, started Botox and fillers as my kind of go-to to begin with and to get into cosmetics. That was in 19. I did the IFA. This is how I started. I got a dual wavelength laser. I'm a dentist, so this laser did dental and facial aesthetics. Technically, if you type in wart removal in St. Paul, Minnesota, our office comes up as the #1 wart removal clinic in Minnesota, St. Paul. So, you know, my SEO is doing something right? So I did lasers, we did facials, PRF facials. This is where I got introduced to Sinclair, which of you are, which is Sinclair now. And this is where it really took off for me. In 2021, we've invested in the V10, the Dermafuse, and the InnoPen. The reason I went this route is because you guys have seen it, combination therapy. This was more of a side hustle for me to just have fun. It really took off after this. Got into that in 2022. We went further, laser hair removal, V30, and a pristine. So microdermabrasion. So this really added an extra, leg to what we were offering at the office. Are we busy? Not as busy as I'd like to be, but at the same time, I only have 1 treatment room. So whereas we're moving into the new office, 5 treatment rooms, 8 operatories for dental. So we've got plenty of space finally. And you guys saw early yesterday, I did the Interjet presentation in 2023. Just a little less than a year ago, we purchased the Interjet, the Premate, and the Dermafuse. Another Dermafuse. This is how important the Dermafuse, I think, is for any office that's going to go, because it really does stack onto a lot of the combination treatments that you'll be able to do. My last purchase was just last month. So the Sunlight Pro, this is that 3D imaging out there. I encourage any of you guys who haven't done it yet, put your face under the light and you you almost freak out because you're like, oh man, that UV thing is killing me. I got to go do some skin care for my skin from the UV damage. I'm going to run through a couple cases, and I got couple last slides here. But this, like Dr. Erlinga mentioned, it's my mom. So she didn't want to go through surgery. Look at her eyes. Top is the before, lower is the bottom, 100% VST. Look at the left eye. That eyelid is draping over her left eye. 6 sessions, VST, you can see that eyelid lift up. That was cool. When I saw that, it was just remarkable what this treatment did. Non-surgical, she can see really well. She doesn't have an obstruction in her vision. That was awesome. Here's the next case. This is one of our staff's moms. 6, I think we did, I'm not sure how many treatments we did, but this was the VFR. This is what you guys heard of where you're doing ablative treatment. Not only did we get the skin to tighten, but if you take a look, I did it brighter. I will confess that I didn't see Devon's class either in presentation on photos. A little brighter, but you can see the pigmentation on the left photo, or your right, after we did the ablative procedure. Skin tightened and all the pigmentation was almost removed. I mean, it's pretty cool to see that. This next one, she wanted to do skin tightening on her neck. You can see from progression from your left to your right, the definition of her jawline. That was 12 sessions of just straight VST. This was before we learned about combination therapy. So just even doing VST alone was pretty awesome. Here's one of my favorites, and I don't know if you guys can see the definition into it. On my right is before, going all the way to the left, 100% VST treatments. Look at how deep her folds are, and look at the fold and the softness of her skin. 100% VST, she looks 15 years younger just from that treatment. All radio frequency, energy-based treatment, non-surgery, all natural, self-rejuvenation, collagen, elastin growth building. Here's another one, V-form. This is one of my favorites. She lost about 4 inches around her waist, strictly V-form treatments. We did 9 sessions for her, 55-year-old female. She was very happy. Just remember, expectation that was really important because you have to let them know that you have to stay on a diet, you got to stay the same weight, you have to be following protocol. Otherwise, if they gain 15 pounds, they're going to come up to you and say, hey, it's not working. So you have to let them know those things up front. Here's the last part of my clips here. You guys all know these brands, right? These are, everywhere you go, you see these brands. You recognize them. You don't even have to know the name outside of FedEx and 3M, but you know these logos. Okay, who knows that and didn't get butterflies in their stomach after watching that? It brings back memories, doesn't it? So you go to Toys R Us and you see everything out there, every toy that you could go in the store and play with. I mean, that is what brings you butterflies. This is what Sinclair can do for you guys. They are truly the Toys R Us of aesthetics for the future. The reason I say that is, one, you can't find a better company in the world right now that has everything at your fingertips, that has all the units that you need on a single platform. This is where my presentation says everything, everywhere, all at once. The V-Series platforms that you guys are seeing, the V10, V20, V30, multitude of treatments. I know my beeps, I'm almost there. But they have a plethora of everything at your disposal. They have everything that you need to be successful. They can help you guys out. They don't want to see you guys succeed, or they don't want to see you guys fail. They want to see you succeed, but they have everything that you need from support to all the units to help. You guys pick what's best for you. You don't have to jump in and spend $500,000 on multiple units. Find out what works for your office and slowly bring it on. You can go big or you can go slow. I mean, you pick, right? These are the units that I own. And so I literally own the entire line of aesthetics that Sinclair has to offer on that side of the spectrum. Again, you guys don't have to do that. For me, my investment was not to keep the revenue in my pocket. It was to reinvest in my team because that is what is most important to me, and it's to reinvest in the clients and the technology that's coming out. You guys don't have to do that, but it's a good way to really, really get into this and really get your team on board. Just the last few things, I apologize, I'm going over here. Just want to leave you guys with this from an overall outcome, dental, medical, and from a cosmetic perspective. We are going to, as dentists, get clients healthier, be more health conscious, and lastly, look and feel healthier. A full package. All these things are the numerous procedures that you guys as clinicians can offer your clients. Sinclair has everything you need, literally, again, right at your fingertips. I don't think you guys can find a better company to work with. Last few things here for you guys to help you out. I know that things with states and medical directors, Sinclair has a medical director for you. If you have a state that does not allow you to do it or treat as a med spa, they have a medical director who will help you and sign for you, so you are allowed to do it. The next thing, how fast you want to do it. Again, we touched base on that. Go big or go small. You take your time with it. What services do you want to offer? Be careful and pick them carefully. You know, be careful how you want to do it, and pick the ones that you think will work best for your clients. The other thing too, find your niche. There are clients out there. They will come and find you, but the nice thing is, as dentists, you guys have a patient pool already there. Again, I reiterate, Sinclair has everything you need. Last thing, pearls to take with you, clinical versus treatment expectations. Make sure you guys set a good baseline of expectations so that client understands that the treatment of results that they will see are based on what you guys have discussed, and they understand that, you know, treatments vary, treatment results vary. So create your own portfolio. Again, we touched this, pictures, 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 worth 1,000 words. Follow up, and the last thing is take your team. Trust your team, invest in your team, because they are the ones who will take you to that higher level, upper echelon of treatment to really pull you guys through into that next stage of the cosmetic world. We started with 3, 4, we're up at 14 staff now in the last 2 years. This is how fast we've grown, and you guys can do it too. Sometimes for me, as you guys are all here, you just got to take that leap of faith so that you guys can be where you guys want to be. This is truth from me, because I have such an awesome team here and an awesome family. And then my last thing for you guys is all the aesthetics you need everywhere and everywhere all at once with Sinclair. So thank you guys.